Excuse me, can I have attention, please? My name is Faisal Saad Al-Harbi. I'm a fifth-year student at Qasim University. Well, a student who almost complete 95% of being a dentist. Download 95% of being a dentist. Well, let me take the chance to welcome our guests who come all over the world to share with us their knowledge and their experience. And for that, we say thank you, gentlemen. It's an overwhelming to see this kind of event which gather around dentists and dental students across the Saudi Kingdom. And I believe that putting the trust in the dental students and allow them to be creative is something quite amazing. And it will bring glory to any educational institution. Allow me now, ladies and gentlemen, to welcome to the stage Dr. Fadi Faddul, Professor and Vice Chairman, Department of Comprehensive Care, Director, AEGD and Faculty Practice Case Western Reserve University, Cleveland, Ohio. The lecture under the name of Studying in the United States Advanced Educational General Dentistry. Welcome, sir.
Thank you. Thank you. And good afternoon, or it would be good morning for us now in the US. I want to thank your Dean, Dr. Ala, the student body, for inviting us to speak to you at this very well-organized, well-attended event. It's very impressive to see this kind of organization and this kind of well-planned event that is put strictly by the students. So congratulations to the students, and we wish you the best of luck in your studies. This topic today is, I am sure, very important to all of the students, and it is in the format of a lecture. However, this really is not meant to be a lecture. For this to be a successful and useful presentation, I'd like to make it an interactive presentation where I'm sharing with you some of the knowledge that I have in regards to studying in the US. I will try to give you as much information as I can. However, this is for you. Please understand, this presentation is for you. So I want to invite you to participate and to ask questions that I may or may not have the answer to. We'll try. I'm going to also ask my colleagues to come up and share their expertise with you, because again, this is for you and it's about you. So we will try to answer as many of the questions that you may have about studying in the US. And I know this is can be at least a very difficult, daunting task to make a decision to travel abroad and to study abroad. So what I thought I would do is I would divide it into some important questions that some of them you have to answer for yourself. Some of them we will try to give you or help you find the answers, and then have you put all that together so that you are able to come up with rational decisions that are going to benefit the endeavor that you are trying to undertake. So we will go through this presentation answering some of the questions as to why do I want to go abroad, what is available for me abroad, and where do I go? The United States is a pretty large space with a lot of different availabilities. So you need to decide, in addition, not only the why and what, but where in the US do I want to go. Once you make those decisions, then you have to decide on how to go about doing this. And I hope by the end of this presentation that you would have thought about the answers that you need to answer for yourselves, and we would have given you enough information for you to be able to answer the other questions. And you also have our information if you need further clarification on whatever it is that you need to know about. You are most certainly welcome to contact us, and we will try to provide you with as many answers as we possibly can. And as I go through the presentation, please feel free to stop me and to ask questions, so you don't necessarily have to wait till the end of the presentation. Sometimes the question comes to you as we're talking, just raise your hand, stop me, and we'll entertain it. Again, this is an interactive presentation. I want you to participate. It's not for me to just stand up here and give a lecture. I have, as you know, I am the director of the Advanced Education in General Dentistry program at CASE, and I have been doing this for a long time, and I have seen many foreign graduates from many different countries come to our programs, and for the most part, everybody has been from successful to very successful to extremely successful. Some of them may be in the audience with us that have participated in some of our programs. But it comes down to this being a personal decision. You must be doing this for yourselves, not as a peer pressure or family pressure or any other pressure, because if you are doing this because of somebody else or for somebody else, the chances for success become not as great. So again, you need to reflect within yourself to see if this is the right thing for you. It is not for everyone to go abroad and to take this endeavor. I know from my personal experience as well, when I left my home country of Lebanon and went to the US to study at a very young age, it was a very difficult decision to make, and it was a very difficult transition as well as initially a difficult process. But again, it is a personal decision that you need to really think about. When you're making your decision, even though I say this is a personal decision and you need to do it for yourself, it's important to talk to your family about taking this step. I have seen several of our foreign graduates who got what we call homesick. And as such, it did affect their performance. Some of them ended up coming back. So before you take this first step, make sure that you are emotionally ready for this endeavor. Talk to your mentors, talk to your faculty, talk to friends who have been in this position, who have been abroad. Going abroad for a vacation or a short period of time is totally different than making a commitment to be abroad for 2, 3, 4, or maybe 5 years. Knowing also that the possibilities of coming back whenever you feel like it is not really that, that easy. Programs are structured and vacations are limited, and vacations are not at or all the time based on your preferences. Vacations, time off, time to travel back is at the discretion of the different programs. So you really need to consider that it's not a vacation, it's a commitment. Some of you may have different reasons for undertaking this field of study. Whatever the reasons are, it's fine, but it's important to really understand them. You have personal ambitions. You want to further your dental education. You want to get into programs that are not necessarily available within your city, your community, your country. So you have some specialty or field of training that you are interested in that you want to attend. So whatever the reasons are, we can help you think of some, but ultimately it is your decision and it is what you want to do and how you want to do it. Many of you want to go and study and further your education so that not only from a personal standpoint, but from a community standpoint, you want to bring back your expertise to your home country and you want to share it with your community. You want to come back, be an educator. You want to help your fellow citizens. So there are a lot of different reasons why you want to go and study abroad. Whatever the reasons are, that's fine. Think about them. We welcome and embrace foreign graduates in all of our graduate programs in the U.S. And we learn from our colleagues from foreign dental schools as much as they learn from us. We embrace the cultural diversity that is available. So it's a very welcome process on our end as well. And it's a very rewarding experience at the end of the day. So I certainly encourage all of you to think about the possibilities and to think about studying abroad as long as you're doing it for the right reasons. So again, reflect on that and make your decisions. It seems like I'm spending a lot of time on this, and I am, because it is really the most important and critical step that you have to take in order to secure a successful endeavor abroad. Because this is the hardest part to think about. And like I tell my residents in some of the stuff that we do, or even my patients, doing the work is easy. Deciding what to do is the hard part. So the process, even though maybe onerous at times, is easy. Deciding to take that step is the hard part, and that's the part that you need to think about. The next question that you need to answer, and again, it's a question that you need to answer for yourself, is what do I want to do? And you need to answer that question to help streamline your search for the right program. Going abroad to study is fine, but going abroad to study what? That's another big question. What is it that you want to do? Are you interested in research? Are you interested in general dentistry? And a lot of people don't think of general dentistry as a specialty or as a field of study. It is. In the US, we have what is called the AEGDs and GPRs, which are general practice residencies. And you can spend 1, 2, or even 3 years in general dentistry. So that is a field of study. Maybe you're interested in the specialties. Maybe you're interested in academics. Or maybe you're interested in a combination of the above. So decide what you want to do. What are your personal interests? What are your professional interests? What are your community needs? Why are you doing this? Again, it goes back to the why. Obviously, we're all doing it for personal satisfaction and for personal interest, but there is always more to it than what's on the surface. All those things need to be thought about before you take your first step. Knowing what to do is going to help you look for the right program so that you're not lost looking at everything. The more you streamline your search for what you are attempting to do, the more successful you're going to be in finding your program of choice. Just as a side note for the first and second year dental students, because it may be a little bit past the time for the upper class people, think about what you want to do from day one. Because depending on what your interests are, you're laying the foundation for that path from first year. If you are planning on going abroad, if you're planning on going into specialties that are highly competitive, you need to be on the competitive edge. You need to spend the time on your studies from day one, keeping your grades up. It becomes very difficult after the first and second year to bring your GPAs up. So your grades are going to be set from the beginning, and looking ahead is going to make it a lot easier for you to get to where you want to go. So let's look for a little bit at what is available in the US as far as advanced educational training programs. And obviously I put AEGD and GPR first on the list because it is close to my heart, near and dear to me. We have, like I said, the general practice residency tracks, which are the AEGDs and GPRs, which stands for Advanced Education in General Dentistry, and GPR is the general practice residency programs. And I'll get into a little bit of the details of the differences between the two a little bit later. And those programs can range from 1 to 3 year programs. Typically they're 1 year. A lot of programs are 2 years. And the 3-year programs, there are a few of them that offer a master's degree option along with the program. Then you have the traditional accredited specialties: endodontic, orthodontics, oral maxillofacial radiology, which is one of the newest specialties in the US, oral maxillofacial surgery, oral maxillofacial pathology, periodontics, pediatrics, prosthodontics, and dental public health. The next track is the non-specialty ADA accredited programs. Those are advanced education programs in specific fields of studies that are not recognized as a specialty by the American Dental Association, but are accredited for their educational programs. And that includes oral medicine, orofacial pain, which is also a newer classification, public health, dental anesthesia, craniofacial fellowships, and implantology, which today is also a very, very popular field of study. And implantology can be both surgical and restorative. There are certain fellowships that only concentrate on the surgical aspect of implantology, some on the restorative aspect, and certainly there are some that concentrate on both. Recently there have been a wave of what we call non-accredited, non-specialty or specialty fellowship programs. And those programs typically are for foreign trained dentists who want to come to the States and spend anywhere from 6 to 12 months in a what we call fellowship along with the residents. This is not an acceptance into a specialty program. This is not a certificate of training in that specific specialty. Basically what you will do in those fellowships is, and that the fellowships are in addition to the number of residents that have been accepted. So you will work along with a resident. For the most part, you're not going to be doing a lot of clinical dentistry. You're going to be doing more of observation assisting, participating in lectures. You may do a little bit of clinical work. The important thing to remember about those fellowships is that they may help you get into a specialty, but there is no guarantee, and they don't give you the credentials to become a specialist or to practice as a specialist, and we can discuss those a little further later if you want me to. There is also the research track, which is either part of the specialties or as a standalone track in the area of research. Most specialties like perio, endo, pedo, they have along with them a master's degree in Master of Science in Dentistry degree for research purposes. There are also some programs that are strictly research. And at this point, I'm going to ask Dr. Kirkwood to come up, as he is the Associate Dean for Research at South Carolina. So he is a lot more qualified to talk about research than I am, so I'm going to ask him to take over the podium for a little bit. Thank you.
All right, thank you everyone, and welcome. Let me stand back here. I'd like to thank the Dean again, and Dr. Ala, for the kind invitation to present to you. So to finish up what Fadi was talking about, what opportunities there are for training and research in the U.S. are vast, okay? Just to pick up where he left off, there are Masters of Science in Dentistry opportunities with the clinical residencies. These are all prescribed by the American Dental Association as 36-month programs that include a master's along with the clinical training. And that's usually a clinical or bench-type research proposal where the thesis is actually defended and written as part of that training opportunity in the U.S. Okay, so this is me. So I'm in South Carolina, and I started there about 7 years ago, and I came from the University of Michigan. So a lot of the opportunities I could talk to you about, I've developed at South Carolina. I'm just giving a plug for the workshop or lecture I'm doing later. I want to describe more of those opportunities at 3 o'clock. But it is a general overview. I'm just going to give you some ideas of what is available as a whole in the U.S. right now. So in terms of biomedical research, And just sort of the history of me, as you can see, I have a PhD. I did my undergrad and then dental school. Then after dental school, I actually trained in periodontics and got my PhD at the University of Buffalo in Buffalo, New York. And with that, that was a program that was actually funded by the US government called the Dentist Scientist Award. And so these types of opportunities have been around the US for over 50 years almost for some of these combined programs. The opportunities that I'm going to share with you don't include that Dentist Scientist Award program that I trained in, but do include other opportunities after dental school, and that's kind of what I want to get through to you this afternoon. So there's really two different types of major biomedical research opportunities. Most of the ones because you're coming in from a foreign country that doesn't give the doctorate as part of a combined program, you can get a PhD, and so everyone is considered, in terms of training in the US, a pre-doctoral candidate from foreign dentist programs as well as US dental programs if they don't have a PhD. So these pre-doctoral opportunities are to do a PhD in the US in either oral health sciences, oral biology, bioengineering is another one that comes up often. Too tight, too close, too far away. As well as postdoctoral training. And the postdoctoral training actually is training for dentists as well as non-clinician PhD scientists after their doctorates. So if a dentist in the US wants to do a PhD after their dental degree, this is a postdoctoral opportunity as really described or prescribed by the National Institutes of Health. So what does it look like? These are quite competitive, as you can imagine. Probably not as competitive to get into as dental school in the US right now. It's quite competitive to get into US dental schools presently. Am I speaking too loud? Want more? Hello. All right. It was for you, Fadi. All right. So in addition to being competitive, these opportunities have both GRE, graduate record examination, as well as TOEFL scores that are required for admissions. The admissions in general are done through the graduate colleges or graduate schools in the US, usually not through the dental schools. And that's an important distinction. Some of the programs that we talked about already are being conferred by the dental school. And so when you do a PhD in the US, it's usually conferred by the graduate school, which is a different flavor altogether. These are generally 4 to 6 years. They can be 3 years for some of the combined programs. We have a DMD or a DDS combined with the PhD type program at my institution. And this is usually 3 to 4 years for the PhD and 4 years for the dental degree. They can be in a lot of areas related to oral health and dentistry, but they don't have to be. And that's critical because a lot of the basic training that one undergoes for biomedical research can be applied towards the oral facial complex, and it doesn't have to involve oral training as part of that thesis opportunity. Importantly, except for very, very recently in the US, clinical research has never considered an opportunity towards a PhD in the United States. There are a few new programs where you can get a PhD doing clinical research. However, most of those opportunities end or terminate with a master's for clinical research. Okay? public health, as Fadi already described, there's a number of opportunities for this, both at the master's and at the PhD level. And so these go through epidemiology, biostats, healthcare delivery, as well as social and cultural determinants for delivery of public health. So these are opportunities that are becoming quite critical to healthcare policy and healthcare delivery in the United States. So this is an ever-growing field. Also, there's a number of programs in the U.S., and so there's literally over 50 of these programs in medical schools. If you look at in total in the United States, even in dental schools, I found 15 different schools that offer a PhD in dental public health through the dental school or through the graduate school at their respected institutions. And what you can't quite see on the slide is a web link for that. There's other master's opportunities, and for most of you graduating from a program in the kingdom here, this is an opportunity that allows you to kind of ease in towards a PhD or allows you to terminate at this master's level. And so without having a lot of research experiences while in dental school, you don't often know what it's like to do bench work. And coming in sort of as an undergrad into dental school, many of you probably didn't realize what it was like to be a clinical dentist until you were in that situation. So in the US, many of the dental schools, in fact, I think most, require students before they matriculate or enter into dental school do a shadowing type of experience, okay? I would like you to think about a master's almost as a shadowing type of experience prior to doing a PhD if you had that proclivity towards doing basic science type research. So masters can be in oral sciences, can be in bioengineering. A lot of dental schools have masters in material sciences related to dentistry. And so these programs are generally 1.5 to 2 years in length. Some of them could be administered through the College of Dentistry or Graduates College. It depends upon the university. The metrics to get in are different. Each school, each college has different requirements. I listed here the GRE and TOEFL because they vary. So in general, if you wanted to do either a master's or a PhD in the US, you should think about doing both, okay? As well as if you look at the programs, sometimes, and I'll talk about this afternoon later, sometimes you can do 2 different tracks within a master's. Sometimes the tracks can actually be just fulfilling mainly coursework, classwork, towards that master's with very little research. You can do a rotation or 2 with investigators. You'll learn the experimental scientific protocols for that laboratory, but you don't have to do any kind of bench work towards a thesis. So you don't have to write a thesis. And then there's another track that allows you to do the basic research or translational research towards that master's. And here I've listed the dental schools that offer a master's in oral biology, oral health sciences, materials, or something like that. Okay. The next big type of master's in the US is in clinical research. And most of this has really come about from these clinical translational science awards from the National Institutes of Health. And so right now in the US, there's 62 different medical schools that have what are called the CTSA Awards, Clinical Translational Science Awards. And what those are, they're very large institutional grants that facilitate the let me use the mouse here, they facilitate the bench work translating into patient-centered research and also community-based participatory type research, how that can then feed back both in the clinical research as well as even further into basic science or translational research. So these are master's types opportunities within this CTSA award. And there's many schools that offer this. There's usually a thesis that is going to be required. Many of the institutions that also have a dental school, what they're doing now is combining the dental degree with this type of master's opportunity. And so there's 4 or 5 different dental schools that allow the student to start dental school and then go ahead and do usually about a year type of master's as a pullout, so they don't do any clinical work during that year, and then they go back into dental school. And so those are the types of opportunities that are there for clinical research. As I mentioned earlier, these types of opportunities they sort of mostly terminate at the master's level for the clinical research, okay? Bioinformatics is a really up-and-coming, growing field. In fact, the last bullet down here is big data. A lot of the electronic health records is generating a huge volume of data from seeing patients both in hospitals as well as dental schools around the world. These are opportunities to query these large data sets and look at these types of opportunities, and there's scientists that need to be trained to look at these opportunities. Also, in terms of the bioinformatics, it includes statistics, molecular and cell biology, translational research to interact with hospitals and dental schools to interface with the clinicians and pull out these types of data. Friday, I'm going to give a talk on evidence-based dentistry, and this type of science is actually critical to understand how to do evidence-based dentistry correctly. And so this is a really high demand science in the US. The people who are trained are guaranteed jobs in the US, which is, incredible, because most scientists in the US have a very tough time getting NIH or National Institute of Health funding. And so this is a big opportunity. My last slide really is sort of a catch-all. And Fadi has already mentioned about these certificate type programs, these fellowship programs. These are opportunities that you could do to look at clinical research residency, but it also can be used to see if you like the biomedical science type residencies. And so these types of opportunities are just developing. And so what I'd like to just convey to you is it's a chance to get into the clinical residency. It's not a guarantee, but along with that is an opportunity to expose yourself during that period of the fellowship for research opportunities. Interact with faculty, interact with students, graduate students, and postdoctoral fellows to see if that's something that you're truly interested in. The other thing is the research exposure, and this would be an opportunity to come to the US and sort of dabble, okay? Not to get the master's, but to understand the opportunities that may be presented by that institution or that individual investigator to really understand if that's something that's right for you. And these are easy. These are J1 visas. most of you know what those are. They can be up to 3 years. If you just did a year, that's quite simple. And the last thing I'm going to talk about is a R90 mechanism. The National Institutes of Health like to use acronyms for everything. It's the U.S. government's favorite thing to do. And so R90 is a type of institutional training grant that can be used now to fund foreign dentists to come to the U.S. and train and get a PhD with U.S. government funding, basically. And so this is congressionally appropriated funds for this, and it's an opportunity. I've listed the schools: University of Alabama, University of Southern California, University of Connecticut, Florida, Iowa, Minnesota, Chapel Hill, University of North Carolina at Chapel Hill, as well as the University of Washington. These are all institutions in the U.S. that allow foreign dentists to come and train and do a PhD in biomedical research, epidemiology, biostatistics, and the U.S. government will pay for that. It's not such an issue for you because your kingdom allows this to happen. You can travel and do this, and your kingdom will pay for it, but it's usually one slot, just to be clear. The way that grant is written, it's a postdoctoral slot, and I have a training grant too, and these are comprehensive. We have pre-doctoral slots on the training grant, postdoctoral slots on the training grant, and so this is one of those postdoctoral slots, and usually there are only 4 or 5 per institutional grant. And the way the grant is written, or congressionally mandated that it was approved, is that it can be no more than 25% of that postdoctoral slot. So usually that translates into 1 slot per training grant to train a foreign dentist. Okay? Are there any questions? All right.
All right, now we have to rearrange this, Keith. What did I do? See what happens when you do a great job explaining things? No questions. Thank you, Keith. Excellent presentation for the research part.
No, doctor, excuse me, but I think we'll manage the questions at the end. Yeah, it will be perfect.
Okay,
for
so
everybody.
we'll have the questions
we'll
at
be
the end.
right?
That's fine.
Yeah.
All right, thank you. So let me... Thank you. Thank you. Let me continue and get through what is available so that we can get to the where and how into the questions. So I will go through some of this a little bit quicker because some of it is self-explanatory, doesn't need a lot of going through it, but there are a couple of different things that I will point out. And again, if you have questions at the end, we'll talk about them. The AEGD and GPRs, they're both general practice residency programs. What's the difference? Why do we have both of those? What do they do for us? The AEGD usually is a school-based type of programs, and the accreditation requirements for both programs are slightly different. Whereas the GPR, the general practice residency, is typically a hospital-based dental residency program. With the GPR, you have more rotations in the medical specialties. You get rotations in the emergency room, anesthesia, internal medicine. So there are different medical rotations that are required for a GPR hospital-based programs as opposed to an AEGD program. They both are going to give you the general practice training. Now, when you are thinking about deciding if you want to do an AEGD or a GPR, if they are available for foreign trained dentists, what you want to consider is what you're going to do after. If you are planning on staying in general dentistry, then probably the AEGD would be a better option because it is giving you probably 2 or 3 more months of general practice training. If you're planning on going into a specialty like pediatric dentistry, oral surgery, even perio and endo, maybe a GPR would be a good prerequisite for you because you will get the hospital training initially that will be required in those specialties. So again, going back and thinking about what you want to do is a good start for you to decide which step you want to take and which direction you want to go. Again, like I said, those programs typically are 12 months. Some of them are 2 years. And the 2-year programs are a lot more popular for foreign trained dentists. Okay. And if you like to get more into research and stay into general dentistry, you will pick the 3-year programs that offer an MSD program. You can get on all of those slides, I am putting the website of the organization that you are able to go to in order to get more information about that specific program. So if you go to the AADS.org, it's going to give you a lot more information on those programs. Dental public health has pretty much been covered quite clearly in Dr. Kirkwood's presentation, but this is a very important specialty, especially for those who want to stay in academia, who want to get into public service, into public policy. At least in the U.S., it is a very clear path towards those type of endeavors. And usually they are about 2 years in length. There are some programs that are a little shorter. If you do your PhD, it may be a little bit longer. You can go to their website, again, get more information on what is available and where. Endodontics obviously does not require a lot of explanation, but I can tell you that it is one of the most sought after popular specialty today in the US, and it has become very competitive. The typical application pool into programs varies in the average of 75 applications for anywhere from 4 to 6 to 8 spots. So it is a competitive specialty. And from what I understand is a lot of the programs prefer a year of AEGD or a GPR training before admitting into their programs. A lot of programs, including ours, also prefer or like to have private practice experience. We've had several of our graduates who came into the program with 5, 6, 8 years of private practice experience before they went into the endo program. So don't think that I am in private practice, I've been in private practice for 10 years, it's too late for me to apply. It is not. Apply, as long as you have your credentials. And the typical length of a program in endodontics is usually about 2 years, and there are 55 of them in the US. Oral maxillofacial pathology is a tough program to get into. There aren't a lot of available oral pathologists. It's, if you go into oral pathology, you know that you will be in demand. It's a very rigorous program. It's about 3 years in length, and you can, a lot of the oral pathology is academic based. So it's a program that is very competitive also to get into. We know that. The newest specialty, oral maxillofacial radiology, actually is becoming even more and more popular every day. It is competitive because there aren't that many programs that offer this specialty. But more programs are opening on a regular basis. And with the advances in technology, cone beam CTs, radiology is becoming an integral part because also of medical legal liabilities. When you take a radiograph, you are responsible for everything that you see on that radiograph, whether it is an X-ray, a Panrex, a CT. If you order it and you are reading it, you better know what you're doing because you can't miss anything that is there. And that's one of the reasons why oral maxillofacial radiology is a popular specialty, is because diagnosing those, we're not, when we take a CT, we're only looking at the bone to see where we're going to put the implant, or we're looking at a tooth. There is more to that on that scan than just the bone where we're going to put an implant. So again, think about that in terms of a specialty. One of the most competitive specialties you can get into is going to be oral surgery, probably followed by ortho or vice versa. But ortho and oral surgery are two of the most competitive specialties, and their admission requirements are, I would say, tougher than most. So if you are planning on going into the oral surgery or orthodontic field, then you, like I was giving you the advice earlier, start from first year, because you really need to be in the top of your class with some very good credentials in order to qualify to enter into oral surgery or into orthodontics, which is the next topic. Oral surgery is usually, it is a hospital-based program, and it makes it a little bit more difficult because of graduate medical education and funding and hospital policies to accept foreign graduates, but they do accept foreign graduates. And oral surgery, depending on what track you want to go into, there are some traditional oral surgery programs still offering oral surgery certificates in 4 years. And the trend now is to do a 6-year program that offers an MD degree along with the oral surgery, where you would spend 2 years in medical school getting an MD degree and 4 years of oral surgery. That requires that you pass the MCAT before you are able to join those programs. Periodontics is a 3-year MSD program for the most part. There are some programs in the US that offer a 2-year certificate. I don't need to talk too much about perio. Everybody knows what that is and what is required. Pediatric dentistry is also one of our favorite specialties. We love kids as long as they go to the pediatric dentists. So we love our pediatric dentists also. It is mostly hospital-based. There are some programs that are dental school-based, and it is two-year programs offering certificates and or a master's degree. The prosthodontics, for some reason, is a very popular specialty among foreign graduates. We have a lot of inquiries and applications for pros from foreign graduates. It is a 3-year program, tuition-based, and it carries a lot of fees along with it for all kinds of different equipments and materials. But it is a very popular program for foreign graduates. There is a relatively newer program in orofacial pain, and I'm going to let Dr. Sadiq Ghazali come up and talk about it, because they do have a program at USC, right? And he can give you a little bit of a perspective on that program. Sorry, I missed your name.
Thank you. All right, so the orofacial pain is a relatively newer specialty. It's one of those, again, it's accredited, but it's not really an ADA recognized specialty. But it will be eventually, because there are a lot of patients that actually suffer from TMJ disorders, TMD, trigeminal neuralgia, neuropathy. And so because of that, it's actually a really growing field. And there are several programs in this. I thought you'd be interested to know that the University of Southern California, where I'm at, actually has a residency program where we take residents. This year we have a resident from Jordan and one from Syria. We also have a concurrent certificate program in orofacial pain and oral medicine. It's a 2-year combined oral medicine and orofacial pain. If you're interested in medicine and pathology and hospital-based dentistry and TMJ and pain, it's a 2-year program, and there's also an online version of this program, which is the only one in the United States. It's a combined 3-year orofacial pain and oral medicine residency, and it's completely online, 3 years, still you pay the tuition and all that kind of stuff. And the only requirement in order for us to do this and be accredited is that each summer for the 3 years, you come for 1 month on site, and you actually learn biopsies and hands-on skills and managing patients and things like that. And that's what allowed us to get the accreditation for that. So for people that may not want to actually, if you're interested in a specialty like orofacial pain and oral medicine, where you're going to do a lot more hospital dentistry and pathology and things like that, that is actually a good option. And mostly it's foreign students that do this because they don't have this kind of training or residencies in their own countries or programs. So they choose this option because in a 3-year program, they only have to actually go to the United States 3 times for 1 month at a time each year. So it allows you to really stay home, work from your own country, stay in your own country, work as a dentist, make money, earn a living, whatever you need to do. But in the evenings, do your coursework, go online, do a lot of teleconferencing through the internet and things like that. So that's a very good, viable option. Anyway, I'll leave that, because we're gonna have a panel discussion, and there's a lot more I actually want to say, but I'll wait till the end.
Thank you. Obviously, we cannot get into a lot of details about each and every one of the programs. We just can give you a brief overview of what's available, and then we can take some questions at the end. And if we can also, if you have any specific questions at the end will all be here, so if you want to talk to us individually, you're more than welcome to do so. For more information on any of the programs available in the US, you can go to one of those two websites, either the American Dental Association or to the ADEA or to the AADS, and you can get all the information that that you need in regards to those programs. So at this point, I was going to ask for questions, but we'll skip that and leave that till the end.
Okay,
So
thank
we'll
you,
continue.
Dr. Fadi. This is the end, right, doctor?
Not yet, just
A few
5
minutes.
more minutes. and
Okay,
then-
take your time, doctor. Okay.
So now that you have decided on what you want to do, the question is where. You're going to need to, the where is going to be important for you to think about because most programs are available in most states. But you have to consider the weather, the social life, the cost of living, and based on those parameters at least, you want to think about which part of the country you want to go to. But more importantly, you need to make your decision based on the programs. Remember that the weather is temporary, but the program is long-lasting. So the important thing is the education you're going to get because you're there for the education and not so much the social life. So look at the programs, research them, do your homework, look at the reputation, look at what they offer. Do they have the clinical applications that you're looking for? Do they have the research component? Do they have the academic personality, if you want, that is going to fit your needs? What are the resources of the program? Are you going to go there and see one patient a month? So there are different criteria that you want to think about and look at when you're researching your programs. And then pick the program that fits your needs, rather than pick the city that fits your needs and then pick the program. That would be a little bit backward. So now how do we go about applying for those programs? I'm going to give you a brief overview of what is minimally required across the board for all programs, keeping in mind that each one of the programs has its own requirements, its own processes that may be in addition to the basic application process. All programs are going to require an application. Usually you're going to need a B plus average or higher to get into most of the programs. Some of the less competitive programs may allow for a lesser grade or GPA. But if you don't have that type of grade, don't be discouraged. Apply anyway. What's the worst that can happen? They say no. So don't be totally discouraged because you messed up on a course or two. If you are ambitious, go for it. Again, some programs may be more rigorous than others. If English is not your first language, then all programs are, or most programs require you to take the TOEFL with a minimum score of 90 on the internet-based testing. GREs are required for most of the MSD or specialty programs, and they require 500 or above verbal, 600 or above qualitative, and 5 or better on writing. And a lot of programs require national board exams. Some require at least part 1, some require part 1 or part 2, and part 2. And now the national board is only reported as pass-fail, so there are no grades to worry about with that. You just need to pass the board. You need to provide a minimum of 3 recommendation letters, hopefully from people that taught you and know you. and can write good recommendations and honest ones. You need to have a personal statement along with that, your official transcripts, and some programs require a personal interview. Some programs can do phone interviews, some programs don't require it. So again, you need to check with each program to make sure that they are, or you meet the criteria and the requirements for their programs. And finally, what can you do to enhance your application and your chances for acceptance into a program? The fellowships that I talked about are definitely a plus. They're definitely not a guarantee, but they are a plus. If you have done a year of fellowship, especially if you do the fellowship in the US, it's going to increase or improve your chances of being admitted into that program or some other program. If you have research experience, all academic institutions are very keen on research. So research is an important component of any educational program. So if you have a research background, research experience, obviously that's a plus. Externships, extracurricular activities, anything that you have done that will enhance your application is something important to place into that portfolio. And think about those as you're going through dental school. If you want to go into specialties and study abroad, start from now, doing your table clinics, participating in research. If you can get into assisting into private practice, that also, anything related will definitely improve and help your application. Now, the important thing for you to remember is that all residencies start July 1st, or most residencies in general start July 1st. So, and the deadline for application per program are different. Some are very early, some start as early as March. So know when the program deadlines are, make sure you apply early, and make sure that you have a completed application. Incomplete applications will not be looked at. So make sure that you look at the requirements. We've seen a lot of good applicants that have lost spots because they forgot to do something. We usually send reminders that you forgot this or that. You have to also look at the fee for those applications. There are application fees for whether you're in match, pass, or a direct application. But even if you're in match or pass, which we'll talk about in a minute, some programs, in addition to that, require a separate application fee. If you don't pay it, then the program director doesn't get your application. Because a lot of times what happens is the applications go to the graduate studies office. They are looked at the graduate studies office, and if they are incomplete, they are not forwarded to the program director, so that they don't get to look at your applications because you forgot to do something. We usually remind people, but again, make sure that you are complete with your application. Now, and especially that most of the time, you're going to require a visa to come to study in the US. Most of the time it's going to be an F1 visa, so we have to generate an I-20, send it to you. It's a process that takes a little time. Apply early to get the time to get all your processes in place. If you're going into hospital-based programs, most of the time you're going to be getting a J visa, which is a special type of visa for foreigners who are studying abroad, and that visa requires you to go back to your home country after you are done with your studies in the US. So there are a lot of different processes that you have to go through, that we have to go through in the acceptance process. That may take time, so that's why you need to apply early. And you're going to talk about the match and the pass. And just as a final note, which may or may not be important to you, but just a typical year of studying abroad, the tuition ranges between $50,000 and $90,000. Instruments, materials can range between $10,000 and $60,000. The living expenses between $20,000 to $60,000, depending on the city you live in. So you can calculate, make the math, and see how expensive dental education is today. And with that, I want to thank you for your attention, and I'm going to ask the panel to come up so that we can try to answer your questions. Thank you.
Well, thank you, gentlemen, for the amazing lecture. And I think this has been precious information will help young dentists and dental students along the way. So now we're going to start the discussion. Feel free to ask or comment. And the gentleman here is kind enough to stand forward and answer your question.
Question? Yeah, so while you're gathering your questions, I'll talk a little bit about the match. So to summarize, start early, figure out what you want to do, because depending on what you want to do, if you want to go into a specialty that's competitive like surgery or ortho, you need to have the grades. And so start early, do your part during dental school to get the grades that you need. And I'd say even if you're a first year or second year dental student and you're not sure if you want to specialize, I always tell my dental students in the first or second year, you may not know what you want to do by third year or fourth year or fifth year. You may, or even once you graduate dental school, you may decide 2 years into practice, I really love kids and I want to do pediatrics, or I really want to do orthodontics or surgery. You're still going to need to have those grades from the years when you were in dental school and submit those and apply with those. So leave that door open for yourself. Do well now so that you give yourself that opportunity later and you don't have regrets and say, I should have did, I could have, I would have, maybe differently, and that kind of thing. So work hard from the very beginning to lay that foundation. The other thing is figure out what you're passionate about. Okay? It's very hard to do this, go to another country, even the students we have in our own country, to just move to another city that's not even far away, go away from home. If you're not passionate about a specialty or research or a residency program, it's going to be very difficult. So figure out what you have a passion for, figure out what you really want to do, lay the groundwork now to do it. Now for a lot of these residencies and specialties, especially the competitive ones, you're going to have to apply through what's called a PASS. It's like a middleman. It's a centralized application service. And they're the ones that are going to get your transcripts and grades and personal statements and all that kind of stuff. And then they coordinate with each of the schools. Okay? Generally, if you're going to go into a specialty, if it's one of the relatively more difficult specialties, you're going to have to apply to many schools, not just one. Okay? You have a wide net and hope that one of them is the one that you get. So you're going to actually have to pay for this application process and for multiple schools. You may apply to 10, 15, 20 schools and hope you get 3 or 4 interviews after those 20 schools that you applied to. And maybe after 3 or 4 interviews, one of them may accept you. Okay? So it's not just, that's where I want to go and that's the one I'm going to apply to. Chances are you're not going to get that program unless you're #1 in the class and you have the highest recommendations and you know the person that's the program director. Okay? So again, pick early, be passionate about it. And then when you go through this matching or pass system, the reason it's called a match system is because you'll apply to, let's say, 10, 15 schools. Then you'll interview, let's say, if you're lucky, 5 or 6 schools. Then you rank those schools. Let's say your 5 schools that you interviewed at. You'll rank your favorite one that you really want to go to as #1. Then you'll rank your second school. Then you'll rank your third school. Okay? This is after you've done your interviews, you've gone home, and now you have to decide, okay, which one am I going to rank high? Generally, you'll rank the one highest that you really want to go to and that you felt like you did a good interview. You don't want to rank the one highest that you think before you left, they pretty much told you, we'll probably never take you. And then what the schools do is now they rank all of the people that they interviewed. They'll rank their #1 student that they want, that they interviewed, of all the students they interviewed. Then they'll rank their second. And the system actually works to the advantage of students because if one of your choices matches up with one of the school's choices, it's what we call a match. and you'll then be placed into that program, and you'll get that program. So you can learn more about that with the PASS, P-A-S-S, online information and website. They'll tell you kind of how that process works. But that's what you need to know, that a lot of those programs are competitive and you actually go through a centralized application service. For the smaller programs like orofacial pain or oral medicine or oral pathology, where there's not as many residents, not as many programs, you don't have to go through this centralized application service. You just directly contact the program. So I'd say start early on and do a few things. Prepare your CV, basically your academic resume, if you will. Prepare a personal statement. A one-page, very succinct, show these things to your mentors. Is this a good CV? Is this a good personal statement? Send it to someone like me. Email me and say, check it for grammar and English, and I'd be happy to do that. And then make a simple one-paragraph cover letter and contact program directors early. Every program that you want to specialize in has a program director. Contact them in your second or third year. Send them your CV, your personal statement, and that cover letter in an email and say, hi, I am so-and-so, and I just wanted to let you know who I am and that I am passionate about this specialty early on. And I would really like the opportunity to stay in touch with you and let you know how my education is going, and at some point, hopefully have the opportunity to interview there or be a potential candidate for your program. Those are people that we remember. Okay, so this is how you have to know the system and be able to game the system to some extent. It's very competitive.
Well, communication, so.
That was great information on the pass and the match. One just last comment before we end the session is that apply for more than one program. Whatever specialty, whether it's a high demand, low demand, always apply for more than one program. Increase your chances of acceptance. There is also a post-match spots that sometimes become available. There are some programs that don't match with the residents because of the ranking system. Somebody drops out. So post-match, there are always some spots that can come open and available, so look into that. And the last thing I want to tell you is I just want to echo the fact that you need to be clear, concise, proper English as much as you can. The clearer your application is, the more impressive you will look for the program. And did you want to add anything?
So yeah, apply to multiple programs, but not different programs. Don't say, I want to do surgery and pedo and ortho, and I'm going to put all of that out there, because program directors will know through that matching or pass system that you're applying to different things. So you don't want to do that, because we actually want someone that wants to be in that specialty. So we don't want someone that's unsure and doesn't know if they want to do ortho or surgery or pedo. We want to know that this is your passion, this is what you've wanted to do for a long time, or at least fool us into thinking that. Okay? Not that I don't know what I want to do and I'm just going to cast the net really broad. So pick that one thing that you're really passionate about and go for that and apply to multiple programs for that. One other thing, interview. So let's say you get to the point where you actually get several interviews and you're going to go there. Sit with mentors. Do a mock interview with a couple of your faculty. You know, have them say, if someone was going to apply to your program here, sit with them and say, what would be some of the questions you ask me? Because that's an area where sometimes students may get nervous, especially if English isn't your first language. But don't worry, just be calm, be yourself. Every one of you here that I've spoken to seems to be social and educated, and so don't worry about the language barrier or anything like that. One of the things program directors look for is, if we take this person on, especially from a foreign country, that's a big responsibility, right? Let's say you take someone into a 4-year or 6-year surgery program. That's a big deal. They're away from home. You may be younger because you haven't done undergraduate education. You're not older. They may not know your level of maturity just based on your age. And that's a big deal for them to kind of adopt you as part of their family now, to live with them for 4 to 6 years, not literally in their home, but you're going to go to social events and this and that, and then they're going to rely on you. In a surgery residency, the last thing they need is for someone to not be able to make it after their first year and have to drop out. Because now they have one less person covering trauma, hospital, rotations, calls. Now other residents have to stay awake extra nights to take those rotations and calls and things like that. So a program is at a major loss if they lose someone because they really weren't ready for that situation. So just keep that in mind. And also for surgery specialty now, because the Part 1 boards and Part 2 boards are pass-fail, they used to be scored, because they're pass-fail, the surgery programs give you an additional requirement now, which wasn't mentioned. It's called the CBSE, Comprehensive Basic Science Exam. And if you go to the AAOMS, American Academy of Oral Maxillofacial Surgery website, there's a site for students that want to get into oral surgery in the United States, and they talk about the CBSE. They give you basically another Part 1 medical basic science exam. It's basically the Part 1 medical board exam, because they don't want a pass-fail student, obviously a pass student, coming into their program. They want to know how high your score is in basic sciences. You can't be a surgeon if you don't know basic sciences at an A level. They don't want B students, and they don't want a B or an 80 percentile coming into an oral surgery program. They want above 90 percentile on the CBSE, or Part 1 medical basic science exam. So it's highly competitive, and that's why they give that exam now, because the boards have become pass-fail, and they don't accept that. So they give a separate exam just for them to know that you know your basic sciences before they teach you the surgery, the pathology, and all that kind of stuff. Because if you don't know the normal anatomy, the normal physiology, you're not going to understand the rest of it.
Thank you. Have anything to add, Doctor? Just thank you. Let's start the discussion. I think now we need some questions. But let me add some funny comments. I think if you get admission in the United States of America, it's like watching a Mission Impossible nowadays. It's have a lot of requirements and have the top requirements, by the way. But I think we need some questions, and I think they have a question around there. State your name, please, and ask your question.
Okay, my name is Ayman Mutahar, studying Faculty of Dentistry, Jazan University. I really thank to you all for this motivation lectures. For example, I want to, from you to tell us about more information about dental public health and the branches over there, because my passion is acting and I love teaching. So if there are any programs for health promotion or something like that, so could you help us by this question? Thank you so much.
Answer, Doctor. Can you take this? What's the question? About the public health. You mentioned more about the public health, right? Okay.
So to rephrase your question, you're interested in dental public health, but you want to be able to teach it. Is that correct?
Or health promotion programs.
Or what? Oh, yeah. I would say that the health policy, the health promotion component with that is always going to be there as part of dental public health. I mean, this is an ever-growing field because of the Affordable Care Act in the United States. Healthcare policy, how that's going to change delivery of healthcare in the U.S. is critical right now. And so understanding that is, and the curriculum really within dental public health and public health in general has changed to adapt to those changes that are going on in our society. So you'll be covered.
That is part of the core curriculum of dental public health education in the U.S., public policy.
Any questions? I think there in the female side. Do you have a mic or organization?
Thank you so much for your valuable information. I'm Rashid Afalaq. I'm a dental intern from Qasim University. I always hear like if you don't know someone in the program, you won't get accepted. Like you have to know them personally. So I just want to know how can I do that without actually going to US. Thank you.
Tariq? You want to take this one, Doctor? Yeah.
So I think the question was, you've heard that it's who you know, right? You have to have a connection or know someone. In the United States, it's all about, you know, hook me up, who do you know, connect me. If that's your son or that person donated a lot of money, that kind of thing. To some extent, that may take place, but to be honest with you, it's a much more objective numbers game. Okay? The main metrics admissions committees, whether it's for dental school or advanced education and things like that, there may always be a few that slip in like that, but that's not the majority. And so don't worry about the few exceptions. Worry about the majority. And the majority is a numbers game. And the numbers that they have to look at is your GPA, transcripts. They're going to look at that. That's what admission committees do. There's a dean of admission, there's a committee, they all sit, and if you're below a 2.5 or 3.0 for some programs, they won't even look at you. Your GPA is different, it'll translate though, and that's why when you apply, you actually have to go through some service to send your transcripts that translate your transcripts to us at the school. Then we can sit and look at it and say, oh, you have, okay, the equivalent of a 3.5 out of 4, because 4 is our maximum. You know, and then we say, that's good. That goes in the pile that we may actually interview or look at. If we see a 2.5, especially for some programs where the basic science grades are low, you know, that's not going to look good. So don't worry so much about knowing someone and being connected, especially because some of that is already happening for you. Thank your dean and Dr. Abdelhamid and the people that have made this and the other students that have made this possible, because now, personally, if I see one of the students coming to applying for our residency programs at USC, I'm going to look favorably upon that. So that's already happening for you, and everyone does that. But this is actually why we do these types of things in conferences, and they bring us here. Yeah, thank you. So, I mean, this is part of it. You know, you're connected into several schools right now already that you have access to faculty. You can email us. You have our contact information. I will obviously respond to that email because I pretty much now feel like we're family. And so that's part of the process. So don't worry about that. Make sure that the scores, the boards, the grades are all there. The rest will work itself out.
You have a question?
I'm Rafi Aishamtiri from...
Raise your voice, please. Raise your voice.
I'm Rafi Aishamtiri, a sixth-year student from College of Dentistry, Jazan University. Actually, I have two questions. First, I would like to ask about the international programs, which is especially prepared for the foreign student, because I heard that it's not as strong as the other programs. This is the first. The second question is it difficult to find or get accepted in Photoshop and maxillofacial programs? And is it the way that guide you to find or get accepted in the residency program for oral maxillofacial surgery? And thank you.
So the international student programs, sometimes called ISP and things like that. So the United States doesn't recognize licenses from outside the United States. So if you want to go to the United States and do a residency, which is a very good question, so we should actually discuss this. When I know that a resident's coming, we always have when it's a foreign resident for a specialty program, we always have the question of, and we tell them this, so I'll tell you exactly what we tell them. We tell them, what are your intentions? Are you coming alone, family? Do you want to go back home and eventually just add this to your skill and then be better, and that's a great situation, right? The reality is what we've seen over the years is once people go to America after a few years, they don't want to leave necessarily, okay? This is where these international programs come in. These people want to stay in the US. They want to practice. And even if you have your boards and your license degree from here and you took part 1 and 2 and you went into a specialty, let's say surgery or ortho or whatever, you still cannot practice in the United States because you do not have a license in the United States. So the only way to get licensure in the United States is to go through a program in the United States. So we've created this system where it's somewhat biased, okay? But we've created this system where, well, we don't really recognize your degree. You have to come here and do dental school again. But generally not the whole 4 years. These programs are shorter, 3 years, for example, and mainly clinically focused. Then you'll get the dental license again. Once you get that dental license through our foreign student program, you're just basically with the dental school, right? Then you can sit for the state boards which is a practical exam, doing dentistry. That's the board exam you need to actually work, make money, and practice. So you can't go with your licensure and your boarding and all that and practice in the United States. So it's basically a barrier for everyone from everywhere else coming in and just being able to work in the United States and saturating our market and economy and making money there. So if you want to do it, we're going to charge you a lot of money and you have to go through this program, and then you can do it. I'll tell you honestly, most of the students, foreign students that come, and they come from all over, and they go to these dental schools that have these foreign student programs, they're excellent students. They're the best of the best, and they're already dentists. They're already trained. We're just making you do it again. So they generally have no problem getting through it and doing it. It's just time and money, which is difficult because you've already done it, and you have to do it all over again. But we say things like, well, it's standards. We don't know what standard they're taught there, so you have to be taught again here. I don't buy some of that. I think the standards are very good in most places and things like that. So that's that component. That's what the international student program is. Your second question as to surgery fellowships. Very difficult as a foreign student to get right into oral surgery. Why? Because it's very difficult as a non-foreigner, as an American, to get into surgery. They're not going to take someone else over one of their own, and even in their own, highly, highly competitive. These are the highest GPAs, the most competitive, driven individuals. From day one, they know they want to go into oral surgery. So whether you're foreign or you're local, the fellowship, the one-year fellowship program, is thought of as a way to get exposure and experience from the faculty and university side. From the student side, the one-year fellowship, and every student knows this, it's a way to get into the program, hopefully. The problem is you're not guaranteed into that program. But think about it. If you go do a fellowship in surgery for a year at some program, if you can get that, you're there for a year. You become part of that family. You work hard. You actually do more than their first year and second year residents because you do the hardest work. They dump everything on the fellow. So in actuality, you get very good training and very good experience in surgery fellowships specifically. And then after that, you would apply. Generally, the thought is, if I killed myself for you for a year, I cleaned the toilets, did all of the hardest work and cases, you should take me after that. That's the expectation of the student. And the programs can go both ways. They can be like, some programs will say, do one more year of fellowship. We'll take you for another year. And they make you do 2 years of fellowship before they finally take you. This is the hazing process, you know. But generally, it is a way to get in. It's better than nothing because there's not many routes for foreign students to get into oral surgery in the United States, highly competitive. So fellowship is a great opportunity to let them know who you are, work your butt off, and then say, look, I deserve to be here. Then they don't have as much of a risk of taking you. Then they know you're committed, you work hard, and they know what they're getting with you. Versus someone that hasn't done a fellowship, even though they had a good interview, they don't know what they're getting with that individual. So it's less of a gamble to take the fellow that worked hard and proved that they deserve that spot.
I just want to caution you a little bit in that sense that getting into a fellowship is in no way, shape, or form a guarantee that you're going to get acceptance into an oral surgery program. Actually, the chances are more that you're not going to get into than you are going to get into. It's an extremely competitive specialty, and I have not seen too many fellows who got accepted into the actual oral surgery program. It's still a great fellowship. I highly recommend it. You will learn a lot. But don't go into it thinking that you're going to get into the program, because the chances are more no than yes.
So just to add one comment about the licensure and the ability to practice as an international dentist. If you come to the United States and do a clinical residency, you fulfill the obligations for that residency, and you decide to stay in the United States at a U.S. dental school institution, there are some states that will allow you to practice within the dental school. So you can't go out and do private practice, but you can still have what's called an intramural dental practice, faculty practice, to do that in addition to your obligations as a full-time faculty member in that school.
Yeah, about the same issue, I want to add another point, that the issue of licensing is a state issue, and it varies from state to state. And some states do allow, if you do 2 years of, I think 2 years of accredited training, they allow you to take the clinical examination, which leads to licensing. So it depends from state to state. Yeah, Ohio too. Ohio as well. So it varies from state to state. So it's not California. Yeah, I think a lot of states are moving toward that as well. So
The states that I know of are Virginia. Actually, Virginia requires only 1 year of postgraduate training in an accredited institution. Texas and Ohio are the other 2 states, and they require 2 years of advanced training. California requires 3 years. California always has to be different.
Okay, any question? You have a mic, right? They
Yes.
bring you a mic.
Yes, here.
I can't see you.
Here.
Yeah.
Yes, my name is Fatima from Barida College. Firstly, thank you for your time, for you giving us from your time. I want to ask about artificial pain program. You said that it's 2 years program, but you didn't say that it must take need for experience years. And secondly, I want a website for your communication for this program.
I think it's special.
Website. I want a website for communication to know more about the program. And I ask about the experience years that you required for this program.
I think you ask about the online course, right?
Yes. No, not online course, about the program, but I want more information. I want a website to take the information from it.
For the or official, right?
Yes, for the all
I think
official
you're going to
day.
take this, right? Yeah, you understand the question, sir?
Yeah, so the oral-facial pain specialty for
Yes.
for Los Angeles, University of Southern California?
Yes, yes.
Yeah, it's a 2-year on-site residency and 3 years if you do it, distance learning website. The website, it's through the USC Ostro School of Dentistry. And the USC School of Dentistry website has links to all of the specialty programs. And you'll see one of the links will be orofacial pain and oral medicine. It's actually a combined program for 2 years for both. But you actually have to track into one of the programs for certification. So you can't get a certificate in both orofacial pain and oral medicine, because each of those is 2 years separately usually. And this is the only program in the country that has it combined, in the world actually, that has it combined. And the way we were able to get accreditation was to say that although they'll learn both orofacial pain and oral medicine, the focus, depending on what your choice is as a student, the focus will be either one or the other for certification at the end. And then you can sit for actually the board exam too in the United States after you take that program. But the USC School of Dentistry website has links, for requirements, and it has a very comprehensive website about all of the requirements and the curriculum and everything that you would do in the 2 years, hospital and non-hospital based and everything like that.
So I can take the 2, oral pain and oral medicine for 4 years program.
No, 2 years both.
2 years for the 2 specialists.
Yes. It's the only one in the world like that, yeah. Very unique. That's why no one's heard of it.
And the in certificate, it will be the two,
No, that's the difference. In the end, you can only choose one certificate.
just one
Yeah,
certificate.
and that's because they
How can I study for two and then take a certificate for one?
basically you'll learn both and you're trained in both, but the accreditation body that governs us wouldn't allow us to be accredited and give certifications for both, because their argument was, how can you teach something that's 2 years each in just 2 years? And we say, because we cram it all into a very difficult curriculum to make it shorter and do it in 2 years. And they said, sorry, we don't buy that. So you can teach whatever you want, and we teach both in 2 years, but you can't give your students a certificate in both. You can only give them a certificate in one. So that we have to stick to that.
Okay, thank you.
This is Halal Barak, a dental intern. I would like to thank you so much, all of you, for this very precious presentation. I would like to ask about the programs. What if I passed and I applied to all the programs and something went wrong, like I didn't get acceptance or the interview went wrong? When should I apply again? Or is there any second chance to apply again, or is it once in a lifetime chance? My second question is about the recommendation letters. What are the kind of recommendation letters that are considerable? Is it from my college staff or from someone I know in the program, or? That's my question. Thank you.
To answer your first question first, I mean your second question first, the recommendation letters, usually we, especially with the clinical programs, we like recommendation letters from faculty that you have worked with in clinical settings. There is usually also a recommendation letter that comes from the dean. That usually is a standard letter. But the important letters are the ones that come from faculty who have worked with you, that know your skill, and can tell us about your credentials and your skills in a more, in a different way.
The degree of the staff matters?
I'm sorry?
The degree of the staff, like if he's a consultant or specialist?
No, it doesn't matter. It's, they can be a specialist or non-specialist. It depends on what you're applying for. If you're applying for periodontics, for example, it would be a good idea to get a recommendation letter from a perio instructor. But usually we like to see recommendation letters from your clinical instructors.
Okay.
So you can, the more personal the letters, the better. But generally, of the 3 letters, like you said, one from the dean, and usually deans have kind of a standard letter that they change the name, and then, because they have to write a lot of these, you know, in the United States. So generally you'll get a good letter from your dean, unless they really don't like you or, you know, or something like that. So you get the dean's letter. The second letter of the 3 letters, you generally want from someone that can really personally speak to your character and integrity, so that when we adopt you and take you for years into that program, we know what kind of person we're getting, okay? And then the other one, as he mentioned, is a really good idea to have it in that specialty that you want to go for at least. Have one in that specialty. If you're going for ortho, it's great to have an orthodontist write that letter. It doesn't even have to be an academic orthodontist. It could be someone, for example, that is in private practice that you've worked with that can say, this person is passionate, has been coming, has been observing me, and really wants to do this, and I believe they will be very successful because I am one also, and they should be one of me, you know, that kind of thing. The other question was, how many times can you apply? Once a year. So you can apply as many times as you would. Right, yeah. Yeah, if you apply the first time, you don't get accepted, you wait until the next year and start your application early again and apply. Each year there's a round of applications and you can't, and that's it. So, but you can apply year after year after year.
I think part of the question is, why would you accept it the second time if you weren't accepted the first time? Depending on why you weren't accepted the first time, it's not always necessarily based on credentials, because depending on the competitive nature of what you're applying to, the second year, because there may be only so many slots. So what I would recommend is that if you apply the first time and you don't get accepted, first of all, don't get discouraged. It's not necessarily a reflection on you. It's just the way the process works. But in that year, in between applying and applying the second time, then you need to do something that is related to what you want to apply for and enhance your credentials in your CV and your ability to get accepted the second time. So when you apply the second time, we need to see that you have something more than you provided in the initial application.
Let's just equal the balance here, because there are a lot of voices here near the question. But I think Dr. Muhammad will need to shut down his office, because a lot of students will come ask him for a letter of recommendation. But I think we have... Yeah. I think we have a question over there. State your name, please.
Abdullah Al-Mulhim, University of Dammam. Abdullah Al-Mulhim, University of Dammam. I have a question about operative dentistry. You didn't talk about it.
You didn't talk about operative dentistry.
This is
That's what you meant, right?
Yeah, this is the first question. The second question, is there like a specialty for a cosmetic dentistry alone? Like only cosmetic dentistry?
The first question is that you didn't mention the operative dentistry, and the second question is there is a cosmetic branch, right?
Yep.
Okay, so we're gonna get this. No. Yeah, the first one is asking about, you didn't mention the operative dentistry. Yeah. And the second question is about the cosmetic, if you have the cosmetic dentistry, if you have any...
Some places have aesthetic or cosmetic fellowships.
Yeah, there is no specialty per se. But there is the... right. They're not specialties. There are programs related to operative dentistry. There is a board of general dentistry that you can also take. It's obviously not a specialty. A lot of it is also covered into the AEGD programs and the GPRs. So I'm not sure if I completely answer your question, but that's what's available.
So operative dentistry itself isn't a recognized subspecialty. Neither is aesthetic dentistry or cosmetic dentistry. Generally, any dentist that graduates should do aesthetic or cosmetic work. Some dentists do say, I'm an aesthetic or cosmetic dentist. What dentist comes out and says, I'm a bad cosmetic dentist or aesthetic dentist, right? We all aim to do the best cosmetic or aesthetics. But given the growth and some of the subspecializations and things like that, there are, in like cosmetics or aesthetics, some schools now have fellowships, for example, where you can do an aesthetic fellowship, kind of like implantology fellowship. So these are starting to come about, and you'll have to look at that individually and find what programs have that. Operative dentistry is actually covered in several specialties. Prosthodontics is heavy on operative dentistry. GPR and AEGDs are heavy in operative dentistry. So if you really want to focus more and get more education in operative dentistry, those would be the types of advanced training you would want, GPR, AEGD, or prosthodontics.
Any question here? I think we have.
This is Majid from Brida College. Dr. Banish, you have mentioned that you always ask your students for getting more scores in their college to have the program that they need. Is there a range of scores, like a minimum score, a maximum score, and a standard score for accepting in the programs?
You understand the question?
Yeah. So if I understand the question correctly, when I tell my students, get good scores, you want to know, so what is the score? What is the minimum? What are the metrics, right?
Yes.
Programs will not intentionally, because they don't want to show bias or prejudice, they won't say that we require a 3.75 or above to get into surgery. No program does that. But I can tell you right now that for almost any specialty, and I don't know the equivalent of your GPA, but ours it's out of 4. 4.0 is kind of the top that you could get. If you get 3.0 and above, that's usually very good for a lot of things because it looks good. 2.99 and 3.01 are probably not much different, but 2.99 when a person looks at it goes into the other pile usually. And 3.01, oh, okay, good. They made there's no real minimum, but they made that imaginary minimum that, okay, they're good. They have at least a B average, And so that's kind of what you want, a B plus average or more. But again, some of the specialties like surgery and ortho that are very competitive really want, almost an A minus to A plus. That's kind of the range that they're looking for. But there's no exact number that any program will give you. So I always say just try your best, and because it's harder as the years go to boost that up. You start with it strong and keep it strong. It's easier to make one mistake and not have it destroy you, versus making lots of mistakes and then trying to boost it up and boost it up and boost it up later.
You have also mentioned that if you have a fellowship for like oromaxillofacial, it will increase your accepting in the program of oromaxillofacial. But also it's not really acceptable. Is this also in other programs, or it's accepting in other programs?
Yeah. So generally it's true. No program fellowship guarantees you into the next position. Oral surgery, because of its competitive nature, it's very hard for even a fellow to get in to the program. But you have a better chance as a fellow, in my opinion, than nothing. Okay? Other programs that aren't as competitive, the fellowship really does help. I don't think it's quite the same as surgery. It's a big benefit to have a fellowship, know those people for a year, and then hope that they take you into that program. Surgery is just the beast. It's very, very difficult. Because of the MD degree too also. In the United States, to be very honest with you, some students that are very smart and competitive but couldn't get into medical school because they couldn't do well on the MCAT and the exams and have the grades to get into medical school, and I have friends and everyone knows this, their way into medical school was through dental school and then oral surgery. Okay, so very competitive, because now you're getting the best of the dental students that almost made it to medical, but they didn't, and now they finally get to make it to the medical school track. So it attracts a very specific type of student, usually.
Thank you.
Any questions? Or?
When I was talking about the fellowships, that it's not guaranteed, I was specifically talking about oral surgery. In the other specialties, it is, I would say, 50-50. There is more chance for you to get into perio, into AEGD, into one of the other specialties through a fellowship. So the fellowships in those other specialties are very important.
Any questions? Last one, and then we'll finish up.
Assalamu alaikum. I am Yasir from Qasim University. My question is about the MBDE examination. My question, I am a third year student. All the time I have courses in my clinic and all the year. I just have a chance in the summer vacation to study for the MBDE exam. What do you recommend to study? Is it enough to study and pass the exam in the summer vacation, or you recommend it after graduation? Thank you.
So the NBDE, the National Board of Dental Examiners?
Yes, especially the step one, which
yes,
is
step
about,
one.
Yeah.
Yes. So the step one NBDE is specifically 400 multiple choice questions, a one-day exam, computerized, and all of those 400 questions are basic science questions. They are in specific topics: anatomy and dental anatomy, microbiology, pathology, biochemistry, and physiology. Those are the topics. Comprehensive basic science, basically. The Only way to pass it is to at least get review books and materials from the United States. One of them is called the Dental Dex for Part 1. There are cards that you get, or review books. Part 1 NBDE review. You need the review material, but most of it is kind of textbook level knowledge of physiology and anatomy and things like that. You need, I would say, at least 3 months, because basic science is basic science. You've learned it here also, but you don't know how they're going to test you. You need to know how they're going to test you because it's always tested the same way. It's a finite database of questions that they use year after year, and it's so finite and they know exactly what the questions are that the curve is set before you even take the exam. They know each year what the country is going to average with standard deviation. If you want, it's pass-fail, so each year the passing mark is different, but generally the passing is about 75%. So if you took a comprehensive basic science exam tomorrow here at your own school, and you took 400 multiple choice questions, would you get 75%? And that doesn't mean, you know, that could mean getting about 270 questions right out of 400, right? Because it's a curve, it's a bell curve, it's a parametric distribution. And you have to be somewhere in that area, right? I would say at least 3 months of studying. You probably have to study 4 to 6 hours a day, and the last month, 8 to 10 hours minimum a day for this exam if you want to pass it easily, okay? You could probably study 4 hours a day for 3 months, and if you have the review materials and you know exactly what's on the exam, you could probably pass it too. There are companies in the United States called Kaplan or Princeton or Hyperlearning that you can find online that you can register for here and take online courses and get sample exams and take them online, mock exams we call them. Students that do those usually do better and are guaranteed a pass. Why? Because you pay a lot of money to take the course online, but you get access to the material, and if you fail, they let you take the course again for free, so there's no charge, as many times until you pass it. And you can take the test over and over until you pass it. And it's offered every few months or so. You register for it online and that kind of thing. So yes, at least 3 months of studying. So if you have a summer, no more social life, no more anything for that summer, you have to put in 8 to 10 hours a day and know that exam inside and have taken a lot of practice exams. And you'll probably pass relatively easily.
I think we will end now. Thank you, doctors, for this amazing and benefits, awesome session. And I think most of the audience here have a quite knowledge about and have a quite knowledge about the first step ahead of the way. And hopefully, inshallah, we will enjoy your company within the 2 days. Thank you, gentlemen. Thank you.
Thank you. On behalf of the panel, myself, I want to thank you for the invitation and for listening. It has been a great session. You're a great audience. Thank you. And good luck to all of you.